Breast cancer is the most common cancer among Malaysian women, making up over 30% of all cancer cases. Despite its rising prevalence, stigma and misinformation have left many hesitant about screening and early diagnosis. To mark World Breast Cancer Awareness Month, we speak to Dr. Azura Rozila, oncologist at Beacon Hospital, and her patient Natasha on fighting stigma and misinformation.
One woman will be diagnosed with breast cancer for 23 women, and it's different between races. Malays are the lowest, 1 in 26, and Chinese is 1 in 19, and Indians are at the moment slightly they're the highest, 1 in 17. And again, I think we need to understand in terms of age groups. I mean, the registry, which you can access on the website, you can see that the highest prevalence would be actually once you hit menopause. The highest is among 60 to 70 years old. But what has been noted by the most recent registry is that for the first time, we're seeing above 40s for this last most recent 5 years, actually they had more cases than the previous 5 years. So I'm saying that we are diagnosing breast cancer younger from age 40 onwards.
Having been diagnosed with breast cancer, Natasha highlighted the importance of awareness on the realities of cancer and family support.
So the emotion part was a greater challenge, if I may say. And I think that's again the stigma and the general understanding of the society of this disease. So the learning process has actually helped me to understand the effects, to get myself prepared for the whatever repercussions there may be from the treatment, and also emotionally prepare myself for every other thing that may follow. Like, for example, I'm pretty aware that I may lose my hair, so I've made arrangement to buy myself a wig. This is still my original hair till date. So yeah, those kind of emotional challenges I faced, and also basically to educate and to bring my family into awareness. So the family support is very, very crucial. So I have been very strong. For some reason, I'm very strong. So I was able to also bring this awareness to my family, so that they could also accept and travel this journey along with me.
Dr. Azura also stressed the need to address the fear of the word cancer.
Patients are still quite embarrassed. They might not share their diagnosis with their relatives and their loved ones, spouses, and that can be a detrimental factor, because we know that their family involvement can be an encouragement or a facilitator for them to take the action for taking action for treatment. Definitely, there's a lot of fear right now in terms of treatment. People think treatment is punishing, is painful. It's always chemotherapy. Like, as you see the statistic, a lot of women, the peak infant incidence, the large number will be in their 60s and 70s, and they would have commonly fatalistic view. They say, like, I'm too old, I don't think treatment is worthwhile. So that does not help in terms of getting patients to come early for treatment. There's so much fear out there. I think people tend to forget, and people don't want to think about it. Cancer is a word that is scary.
Dr. Azura and Natasha also discussed the challenges when it comes to access to screenings and treatments, highlighting the importance of a comprehensive and inclusive program.
In terms of access, we as a nation, we are not ready to roll out a comprehensive national health screening program, which is being done in high-income country. However, the government has sponsored some of the costs of mammogram, sometimes in totality for the for the relevant socioeconomic group. LPPKN, for example, sponsors mammogram every year. There's a quota, of course. On a state level, there is some as well. On top of that, we have NGOs like MACNAW and SASM who actually have got the same, and they even have a mobile mammogram that will go outreach to communities. But certainly this is not ideal. I mean, there's one unit, as far as I know, for the Peninsula, one in Sabah and Sarawak. I mean, how are you going to cater for the millions of women?
Natasha also emphasized the need for a targeted screening and awareness program.
The awareness is there, but what probably is lacking is the awareness to reach a certain targeted group, certain ethnicity. So that probably is missing. There's a lot of avenue, but how many of our society members are actually reaching out to these platforms? How many of them are basically interested to understand what are the effects of breast cancer and the diagnosis prior to a prior diagnosis. So this awareness should reach targeted groups. Much as there are many platforms, perhaps we can consider looking at certain target groups by way of social media or talks in companies, which is what I'm actually intending to do, to have a talk in the company that I work, so that breast cancer awareness can be given, because as far as I know, I'm the third person who have been diagnosed with breast cancer, at least in my company.